Hi, my name is Kelly Flynn, and I'm doing a physical exam of the musculoskeletal and cranial systems on my mom. Mom, say hi.
Hi.
Let me hold that right there. First, we're going to start with observing the musculature of the face. The face is symmetrical and round and proportional. We're going to observe the musculature of the neck. The neck is symmetrical in musculature and proportional. Now we're going to assess the temporal mandibular joint. Have you open and close? There is clicking felt. No pain or tenderness noted when palpated. When palpating the neck, there's no tenderness or pain noted upon palpation. And we're going to assess the range of the motion of the head and the neck. Can I have you look up for me? Touch your chin to your chest. Look to your left. Look to your right. Put your right ear to your shoulder. Left ear to your shoulder. Now we're going to assess the spine. The head is aligned. The head is aligned with the spine and the neck. Spine is midline and symmetrical. We're going to assess the range of motion. So I'm going to have you turn to the side. Bend forward and touch your toes. And stand up. Extend your back backwards. I need you to face the other way. Back towards me. Back towards me. I'm going to have you rotate side to side from the waist up. 1, 2. Perfect. And now we're going to lateral bend. So one hand on the hip, other hand out, down to the floor. Now reach. Now switch. Good job. We're going to palpate the spinal processes. The cervical is aligned and symmetrical. The thoracic is aligned and symmetrical. And the lumbar is aligned and symmetrical. We're going to assess the prevertebral muscles. I would be doing this with both hands. And they are symmetrical, and there is no tenderness noted upon palpation. We're going to assess the shoulders. The shoulders are equal in height and symmetrical. I'm going to have you turn towards me. Have you stick your hands out. We're going to assess the top and the underneath of the hand. We're going to assess the fingers and the wrist. Assess the fingers and the wrist. There are 10 digits noted. No edema, tenderness, or mass is noted in shoulders, elbows, wrists, and hands. Shoulders have full range of motion, and we're going to demonstrate the following. On the side. We're going to do flexion, extension. Yep. And then I'm going to have you turn towards me. And we're going to demonstrate adduction and abduction. Good job. Next, we're going to demonstrate the shoulder muscles strength. We're going to do the supraspination and the infrasupination. So I'm going to have you put your hands out, put your thumbs down. And here, this is where I would push outwards as she resists inwards. And I would do both hands equal in strength. Now I'm going to have you bend your elbows. And I'm going to try to push her hands outwards as she resists. And this would be on both hands. And the strength on that is equal and symmetrical. We're moving on to the elbow. We're going to assess the range of the motion of the elbow. So I'm going to have you make a flex position, flexion, and extension. That's good. And then we're going to do abduction and adduction. Good job. And we're going to assess the muscle strength. So I'm going to have you make a fist and flex. And this is where I'd have her push against me. Good. And then I'm going to, at this angle, I would put one hand here, one in here, and I would pull and have her pull back. Perfect. And I would assess that on both sides. Then next, we're going to assess the wrist. We're going to assess flexion, extension, and abduction and adduction. So we're going to assess flexion, extension, and then we're going to assess adduction, no inwards, and then abduction outwards. And here, I'm going to have you make a fist. And at the wrist, I'm going to push down and you try to push up. Good job. And then for the fingers, we're going to demonstrate the range of motion. So I'm going to have you with your fingers. We're going to do flexion with your fingers down, extension with your fingers up. Now midline. When you open your fingers, that's abduction. And you close your fingers, that's adduction. And now I'm going to have you give me your thumb. This test is the Tinel's test. So I'm going to push down on her thumb and she's going to resist. The next test is the Phelan's test. I'll have her open her hands, open the fingers. I'm going to squeeze these two together and she's going to resist. Perfect. Now we're going to assess the lower extremities. We're going to assess the hips. We're going to assess the hips. I'm going to pull your pants up. They're equal, symmetrical, and they're right over the knees. Open your legs. The knees are equal, symmetrical, and stacked over the ankles. Ankles are equal and symmetrical and stacked over the feet. We're going to assess, there are 10 toes present. No tenderness noted when I palpated the hips, knees, ankles, and feet. We're going to assess the range of motion of the hips. So I'm going to have her lay on the bed, and we're going to assess flexion. So I'm going to have you take one of your legs and pull your knees to your chest. That's flexion. And for the purposes of this, for extension, she would lay on her stomach and she would bend her leg and try to lift her leg to the sky. And that would affect the gluteus muscles. Now we're going to show abduction. So I'm going to have you bend your knee, lift up, rotate it out. That's abduction. Now rotate it in. That's adduction. Now we're going to demonstrate external rotation. So knee bent. You're going to cross over the midline. Yep. Now revert. Now move that out to the outside. That is internal rotation. We're going to assess for the strength. So here, I'd have you put your leg down. I would put one hand on her hip and ask her to lift the opposite leg as I push down, supporting the other hip. Moving on, we're going to assess the knee and its range of motion. So I'm going to have you stand up for me, please. We're going to demonstrate flexion extension with a squat. When she goes down into the squat, that's flexion. When she stands up, that's extension. I'm going to have you sit on the bed. I'm going to have her demonstrate internal rotation by swinging this one leg towards her midline, and external rotation by swinging it out away from her midline. Perfect. Now we're going to demonstrate the muscle strength of the knee. So here, I would have her try to lift her leg as I resisted. Perfect. Equal and bilaterally for the knee. Next, we're going to assess the range of motion in the ankles. Here, I'm going to have you demonstrate flexion. I'm going to have you point your toes to the ground Extension, point your toes to the sky. Inversion, your heels should turn inwards. Exversion, your heels should turn outwards. We're going to assess the strength. Have you lift your foot up for me? I'm going to push on her foot, and she's going to fight back. Perfect. And I would assess that on each foot. And they're symmetrical. I'm going to have you wiggle your toes for me for full range of motion. Perfect. Now that was the musculoskeletal system, and we're moving on to the nervous system. We're going to assess the patient's level of consciousness. Can you tell me your name, where you are, and what time it is?
My name is Flynn. I'm at 20 West Dallas Ave, and it's 9 o'clock at night.
Patient is alert and oriented ×3. We're going to assess the cranial nerves first. First cranial nerve is the olfactory, which is smell. So I'm going to have her close her eyes. I'm going to be having her smell perfume. She does not know. I'm going to have her smell and tell me what it is.
Perfume.
Perfect. Cranial nerve 2 is the optic visual acuity. This is where we would assess her level of vision. Cranial nerve 3, ocular motor. Cranial nerve 4, trochlear. And cranial nerve 6, abducens, can be assessed with the 6 points of visual field. So I'll have you follow my finger. We're going to make an H. Perfect. And here I would also take my pen light and I would assess her pupils for Perla. Pupils should be equal, round, and reactive to light and accommodation. Cranial nerve number 5 is trigeminal. This is where we would do face sensation. I could take a cotton ball and touch her face and tell me if she feels it. Can I have you clench your teeth for me? Perfect. That demonstrates the trigeminal. Next we have cranial nerve 7, which is the facial. So I'm going to have her smile for me, frown, raise your eyebrows, puff cheeks, show your teeth, purse your lips, and blow. Next, we're going to demonstrate cranial nerve 8. I'm going to whisper 99, and she's going to tell me what she hears.
99.
And I would do it in this other ear.
99.
Perfect. We're going on to... In that test, we would also do the Rhine and the Weber, which uses the tuning fork. Cranial nerve 9 is the glossopharyngeal, and cranial nerve 10 is the vagus, which can be demonstrated with yawning and gagging. Can you yawn for me? And can you gag? Good job. Next, we're moving on to cranial nerve 11, which is the spinal accessory, which is the shoulder and neck muscles for strength and movement. Can I have you raise your arms over your head? Raise them down. Move your head side to side. This is just present. Finally, cranial nerve 12, which is the hypoglossal, which is tongue movement. Gonna have you stick your tongue out. Stick it up, down, side to side. Perfect. Now we're moving on to the motor system. In the motor system, I'm going to have you stand up, have you walk to the closet, and walk back. Gait is steady and fluent, and balance is equal. We're going to assess the Romberg. So I'm going to have you stand still, eyes closed. This you would do for 30 to 6 seconds. Balance was maintained and steady. Next, we're going to do the pronator drift. So stand still, put your arms out with your palms up, and close your eyes. Have her stand like this for 30 to 60 seconds. This is where you would tap her hands and see if she lost any balance. Balance was maintained. Next, I'm going to have her demonstrate to hop on one foot. Perfect. And demonstrate the heel to toe walk. Perfect. Now I'm going to have you demonstrate the rapid alternating movement. Perfect. And now we're going to demonstrate the rapid finger and nose test. Perfect. And one more. And when you slide your leg down your heel. Perfect. Now we're moving on to the sensory system. I'll have you sit down. We're going to test the extremities for superficial tactile sensation. First, we're going to demonstrate pain. So here I have tweezers. One end is sharp, one end is dull. I'm going to have her close her eyes, and I'm going to touch her on her arm or her hand, and she's going to tell me if it's sharp or dull.
Sharp. Dull.
Perfect. Moving on to the vibration with a tuning fork, I would put on her hands or on her toes, and I would set up the tuning fork and ask her if she felt any vibration. Next is the position. This is where I'm going to have her close her eyes. I'm going to grab one toe, and I'm going to move it in a direction, and she's going to tell me where I'm moving it.
Up. Down. Side. Side.
Perfect. Next, we're going to do the stereognosis, which is recognizing an object with eyes closed. So I'm going to have her close her eyes. As you can see, this is a phone. She doesn't know, and I'm going to have her identify it.
Cell phone.
Correct. Now moving on to the 2-point discrimination, pressure on 2 points. Using the same tweezers, I'm going to have her tell me when she feels the 2 points.
Now. Now. Now.
Perfect. Now moving on to the graphthesia, I'm going to draw a number on her hand with her eyes closed, and she's going to tell me what it is. I'm doing the number 3.
3.
Perfect. Next, we're going to assess the deep tendon reflex. The first reflex we're going to assess is the bicep reflex. So here, I would have my finger, and I would use my instrument, and I would hit it and look for a response in the arm. Moving on to the tricep reflex, have her put her arm down to the side. I would put my finger here, and I would assess the deep tendon reflex here and look for a response in her tricep. Moving on to the brachioradialis reflex, I would put my finger here and use my instrument and assess for a reflex in the hand or in the wrist. Then moving on to the patellar, which is the knee, I would tap the knee with the hammer and look for a response. Awesome. Next would be the Achilles or ankle reflex. Here is where I would put the instrument and I would hit there and look for a reflex in the foot or the ankle. And then I would assess the ankle for clonus. So this is where I'd have her put her foot up and I would push and I look for a bounce back. And I would assess this on both of her feet. Finally, the plantar response, also known as Babinski. I'm going to stroke her foot. Perfect response. That is a negative Babinski. And that is my assessment on the musculoskeletal and nervous system. Thank you.